My name is Erica Perez, and I'm going to point out and describe the axial skeleton. We will start with the cranial bones. This is the cranium. Frontal bone. The top two are the parietal, left and right. The back is the occipital. The external occipital protuberance is this little nudge here, and it's basically the outer part of the occipital bone, and it provides attachments for muscles to hold up the head properly. Next, we'll go over the temporal, the external view. So the temporal mandibular joint is here. The mastoid process is also in this area in the corner. The styloid process is a little bit higher, and the external acoustic meatus is this little hole that we have and we find right at where that joint is. The squamous part is above the ear area. The internal view, although we can't see much, the petrous part of the temporal bone is this area here, and it houses the middle and internal ear cavities. The internal acoustic meatus is also right in this corner here, where the mandible and maxilla meet, and this internal acoustic meatus transmits the cranial nerves 7 and 8. Next is the sphenoid, which is here on the sides of the eyes. The lateral and orbital parts of the greater wing are in this area. And the internal view, the lesser wing forms part of the floor of the anterior cranial fossa. Although can't point it out. The greater wing projects laterally from the sphenoid body in here. And the optic canal lies anterior to the sella turcica, and the cranial nerves 2, which are the optic nerves, are what pass through. In the sella turcica sits the pituitary gland, and that would be found back here, and that's the upper surface of the sphenoid bone. Next, we'll go to the ethmoid, the internal view, the crista gagli, and this helps secure the brain in the cranial cavity by attaching to the dura mater, which is the outer covering of the brain, and the cribriform plate passes through the cribriform plate helps form the roof of the nasal cavity, and the olfactory nerves pass through there. Next, for the sutures, the cranial sutures are the coronal, which is here, and the frontal bone and the two parietal bones are what make up the coronal suture. For the sagittal, it's the middle suture here, and the two bones that make up the cranial suture are the parietal left and right. The lambdoid suture is back here, and that's the occipital bone and the two left and right parietal bones. The squamous is the temporal bone and the parietal bone. So the squamous suture is found here on the sides, and it would be the temporal bone and the parietal bones. Next, for the facial bones, the maxilla and the alveolar process. The maxilla is the upper part of the teeth, and the alveolar process carries the upper part of the teeth. The nasal bone is here. Zygomatic are the cheekbones, this area, and the two bones that make it up are the palatine and the maxilla. The vomer is found in the inner nasal cavity, And the inferior nasal concha is right in there as well. The mandible is the lower part of the jaw, basically. This is the body. The ramus are the sides that attach up here. And the mandibular condyle is up here by the ear. And the mandibular notch is right underneath the cheekbone. And the coronoid process is right on this section here. Right underneath there. And the vertebral column is next. Here's the vertebral column. The curves of the vertebral column, there are 4, and it starts with cervical, thoracic, and then this curve is the lumbar, and the last one, which is the sacral. The 2 that are primary are the lumbar and the thoracic because they take the most pressure and weight bearing. The next one is the cervical vertebrae. Start with 7 bones total, C1 to C7, and they articulate. C1 is the atlas, basically, is C1, and that articulates with the skull to attach. The C1 atlas allows for lateral rotation, so when you shake your head, no. And that what's unique about the cervical is that C1 and C2 have minimal transverse process, which allows for more lateral rotation. Next is the thoracic vertebrae, which are T1 through T12, which are 12 bones. And to point out, the spinous process is these that are sticking out, the little bones that are sticking out. The intervertebral foramen is the actual vertebra and the hole in there, and the spinal nerves from the spinal cord are what pass through the intervertebral foramen. The transverse process are the 2 little bones sticking out to the side, which the attachments I'll explain later. And the body of the vertebra is each one of these, which are the centrum. And the position of the intervertebral discs lie in between each vertebra. Next, for the sternum, this is the sternum as a whole. This is the manubrium, the body of the sternum, the xiphoid process, and the jugular notch is right above the manubrium. For the ribs, we're going to point out the vertebrosternal, which are the true ribs, and it's these 7 pairs, more so on the side, so it would be 1, 2, 3, 4, 5, 6, 7 pairs. And the vertebral chondral are the same 7 pairs, but more anteriorly and medially, which are made up of the cartilage. It's 1, 2, 3, 4, 5, 6, and 7. And then to point out, the floating ribs are found in the back, and they're considered floating because they don't attach to the anterior part of the thoracic cage. And the actual one rib, to point out the head of one rib, it's nearest to the spinal column, and the neck as well, and the tubercle of the rib is found in that section also, and that's how it articulates to the transverse process of each vertebra, and that is how they are attached.